No worries. So, yeah, give me 1 second. I'm actually going to pull up the slides to make things a little bit easier. And we are going to remember, guys, when it comes to overreaching, overtraining, that effectively we are talking about doing more work than the body can recover from. Key is overtraining is usually a far harsher, or it is far harsher on the body, where you've done more work than your body can recover from for so long that now you really beat yourself down into the valley. So here is what we're talking about. As far as overreaching is where we're doing more work acutely than the body can recover from. Now, this is not necessarily a bad thing, because as you become more and more well-trained, you typically need to go through essentially harsher and harsher training volumes in order to get any or about the same amount of progression you were getting previously. So like anything else, we're going to have an initial decrement, then we're going to finally super compensate and be better than we were before. Whereas overtraining is where we're literally just beating someone down. We're doing more work than somebody can recover from. It's beating up their body. And due to this, they're obviously going to be injured and potentially never even reach their previous levels of performance thanks to said, excuse me, injuries. So, and then for Jessica's question, would there be any direct or indirect effects that adaptations to the cardiovascular system could have on limiting or enhancing speed? So if you're thinking about the ability to deliver nutrients to the muscle and remove waste products, in theory, that's going to be another potential way that you could help with keeping up velocity. But when we're really talking about peak velocity, peak speed, we're really talking more about that ATP PCR system and anaerobic glycolysis. So since that's so acute, it's likely to not be that much of a limiting factor. No worries. So how many sets and reps we're going to be doing is going to be coming down to obviously what we're trying to accomplish. So if our goal is for muscle hypertrophy, and I believe, yeah, this is kind of going through the joys of these sort of things. Give me 1 second. I'm going to pause the share. And I believe I'm looking for, okay, here we are. So here we have is the basic ideas of the sets, reps, and effectual like other performance metrics, rest periods, and otherwise you'd have individuals working at depending on what you're trying to do. Now, for most folks, we're really trying to develop strength. We're really talking about usually sets of 3 to 5 repetitions, even lower repetition set than that, and multiple sets of those exercises. Now, the next slide shows you what's known as the Prolopin chart, and this is good for both power and strength development of how many reps they're going to be performing at a given percentage for each set, and then how many total reps we're trying to get those athletes to do in those given percentage ranges in a given workout. Now, this was initially designed for essentially Olympic lifters. That was based on a statistical breakdown of Olympic lifter training, but it gives you an idea to try to work within. Now, I personally really enjoy this graph as well because it gives you information as to when we're training with loads that you can only do 2 reps, you can only do 3 reps. So this is meant to be, each set is taken pretty close to failure. It's very, very difficult. When we're talking about sets of 5 or less, now we're talking about really developing power. When we're talking about sets of 6 to 12, that's where we're going to get the most out of hypertrophy, but we're still getting some effects on power and strength and some on muscular endurance. And once we're getting over 12, now we're talking about huge increases in endurance and far less effects on hypertrophy, strength, or power. Now, their goal there is you want to think about just, once again, total training volume. So doing one set to failure is probably not enough volume on a lot of exercises to really get a bit of an overload, but you're looking at how many sets you're doing of an exercise to a true training set, as well as how many, not just the sets you're doing per the exercise, but how many total training sets you're doing per essentially you could think of it as muscle group or kind of body or action or otherwise. So if you were going to go in the gym and only do effectively one, maximal set of 10 on the back squat, okay, like, you've put a little bit of training stress on your quads, your glutes, your hamstrings, your spinal erectors, and so on. But if you were to do one maximal set on overhead squats, front squats, back squats, safety squat bar squats, high bar squats, low bar squats, wide stance, narrow stance, deadlifts, hex bar deadlifts, sumo deadlifts, all of those total sets are using very similar muscles being recruited maximally. That's going to be what really beats somebody down. So we typically want to only do a limited number of exercises in a given workout. And within that given workout, we want to make sure that once we've effectively induced some fatigue, like that muscle is now tired effectively, it's no longer as robust and as strong as whenever we started, that's a pretty good indicator that you've trained hard enough for the day. And from there, it's probably time to move on. Now, for people that are really in bad shape, they're just not very well trained, they might be able to get this effect from just one true training set. Individuals that are really highly trained, it might take them 4, maybe even 5 sets of, once again, going pretty close to failure to get that same overall fatigue to be induced. I do not. Yeah, I would not want to be the person that had to do that much work in order to have that type of fatiguing effect. So, Holly, does that kind of help explain the concepts there that we're, looking for? What other questions would you guys like to work through? Okay. So caffeine has a number of ways it's going to help enhance performance. First and foremost, it obviously helps a little bit with essentially fatigue, helping you feel a little bit more energetic. It also helps decrease sensations of pain, which tends to help everybody when it comes to athletic performance, as well as it's also going to help with freeing up fatty acids for aerobic metabolism. So it's not just going to help with increasing essentially muscular recruitment power output and strength, but it's also going to help with, once again, freeing up those fatty acids for aerobic style performance. And irregardless, if you're an athlete and you're training hard, the idea that you're not going to be able to perceive as much pain is going to help anybody with performing on a higher level than they were previously. What are the questions would you guys like me to help you review on? No worries. Rhabdomyolysis is the destruction of essentially muscle cells. And this is going to occur from doing really, really hard training. Typically, when someone is untrained and they happen to be not necessarily untrained, but they were well trained, they're out of condition, they can be dehydrated, maybe a little hungover, and then pushed incredibly hard, doing a lot of eccentric style training, a lot of impact training. And this in turn causes your muscle cells to literally fall apart. All those proteins that were inside of your muscle cell membranes are now getting in your bloodstream. And that's really, really, really hard on your kidneys. That's why if someone suddenly has urine that looks like cola, that's a pretty good indicator that they're going through rhabdo. And if they don't get to a hospital immediately for doing things like dialysis, now we're talking about literally renal failure, which can also obviously lead to death. So it's destruction of red blood cells. It happens from really hard training. And like I said, typically individuals that were in pretty good shape took a layoff and then came back too hard. And unfortunately, it's been tied to a number of coaches just brutalizing their athletes for one reason or another. It's usually not for great reasons, but I'm not going to comment on that too much more. Yeah, no worries. We can go ahead and bring up the old exam and go through that a little bit more. All right, guys. So the first one we're going to go ahead and have you guys work a little bit on groups on is going to be number 10. Let's go ahead. It's 142. I'm going to give you guys until effectively 148 to figure out effectively what are going to be the illegal ways that we're going to go ahead and enhance an athlete's aerobic performance. So have some fun. We touched on obviously those components, and hopefully you guys are going to be able to come to the answer pretty quickly and be able to post it in. So whenever you're ready, go ahead and hop in those breakout rooms, and then I will see you guys back in here in a few moments. Nice. Yeah, good work. HGH potentially for its overall positive effects, absolutely, on lean mass, fat mass, and everything else, as well as obviously blood doping. Good, good. What else? What else were some options we could use to enhance the the performance of aerobic athletes? Anabolic steroids absolutely can potentially as well increase aerobic performance. Now remember guys, outside of blood doping, we also have the use of erythropoietin. So that's also going to enhance performance, as well as if we're trying to get a little bit better at a little bit better performance, aerobic performance, we could maybe use things like, beta agonists. So some folks will use effectively pharmaceutical intervention type of inhalers and otherwise to enhance their aerobic capacity by effectively using drugs to get vasodilation so you get better blood flow. Awesome, guys. Good work. All right, so with number 11, I don't think we're going to have you guys worry about, well, let's do this, okay? For the groups that you guys were in, I want group room 1, so that's Abby, Colleen, Courtney, Lincoln, and Zaria. You guys are going to be looking at effectively those different supplements, and I'd like one supplement each, but you guys can help each other. Group 2, I want you to go ahead and talk about the side effects of the abuse of not just anabolics, and notice says other PED use, so think about the abuse of growth hormone, as well as some pathomimetics, ephedra, and otherwise. Does that make sense before we send you guys over to your next little group thing? Awesome. So let's go ahead. The rooms are open again. Make sure you're helping out one another if you guys need so. And then also when you think about the supplements, guys, think about the dosage. How much of the supplement do you need to take in order to have those effects? And same thing with the side effects. See you guys back in a few. Be careful with caffeine. Holy cow. Okay. Caffeine, you want about 3 to 6 milligrams per kilogram of body mass. That's the way to think about it. So don't think of it as total milligrams, think of it as the size of the individual taking them, since obviously a much larger person is going to need much more. And there's also some genetics there. Yeah. Holly, good work there. Yeah, and Courtney, again, creatine is going to be another that's relative to the body size. So typically you're going to see a chronic intake somewhere between 3 to 5 grams, usually per day. Good. And there's really not that much information showing actually amino acids enhancing performance too much. That's okay.
Yeah, I was typing out about like some of the risks of the sympathomimetics and the amines, and it was saying that it can be really addictive and then also causes like different senses of euphoria and can delay the sensations of fatigue when a person is training. So then that could enable them to like push over their normal limits. And then it also has different effects on like heart rate and blood pressure to where it creates like greater stresses on the cardiovascular system and then can also trigger cardiac arrhythmias.
Good work. It's usually 3 to 6 milligram per kilogram of body mass when it comes to caffeine consumption. So good, folks. Okay, so let's kind of look our way through a little bit further. Let me know what you guys think the answer is going to be for 13, 14, and 15. Good works, folks, on 13, because growth makes sense. It's just the increasing in size. Development is there where we're talking about differentiation of functional changes throughout the body. This is really most obvious there when it comes to like fetal development. And then maturation is literally maturing into an adult. So kind of the final part of the development. Now, difference in peak growth rates between the genders, it's going to be girls develop faster. Girls typically are going to hit their peak height and be fully mature before males, physiologically and neurologically. If you guys remember back to the prefrontal cortex and how that helps you make good decisions and how that tends to mature, or is one of the last things to mature, and it tends to happen much later on in life. And then how does body fat change with development? Yeah, it's an involved answer. Most folks are going to increase body fat a little bit from birth because we're actually can be relatively lean, but even that there's some variability. And then there's not a big difference between both genders of body comp until you hit puberty, and that's usually where guys tend to lose body fat and ladies tend to increase body fat. Hence, it's a bit involved. Okay. How's the cardiovascular system change with development? Actually, it's pretty much all of those. Yeah. You're going to have a bigger heart. Your maximal heart rate is going to go down a little bit. You're going to have better capillarization throughout the body and a better hematocrit. And then how does our strength change with development? Yep, we tend to get stronger. So how does programming for strength change with development? It's effectively going to be intensity. You're not going to be maxing out little kids. That's just dumb. Don't do it. And the adaptability, meaning kids tend to not make as much progress, obviously, as individuals once they've gone past puberty if they're untrained. So hence, understand they're going to probably make a little bit less improvements. And then variety can really be about the same between the two groups. Adaptability, you're going to get better once we go through and become more developed. How does activity in general affect growth and maturation? It doesn't really affect it unless you're doing insane amounts of physical activity and nowhere near enough eating. And then difference in performances between boys and girls under 6 really isn't any. Boys and girls are going to perform at pretty much going to be the same level. So actually, sorry, physical performance between boys and girls change from ages 8 to 18, relatively similar until puberty really onset. So that's usually gonna be around age 12, as we're gonna see men's performance in general is gonna be better than women's on average. Okay, now for 23 guys, what would you guys say of the options up there is gonna be probably the most accurate? Good. And then what's gonna be pretty close? Bod pod or underwater weighing. Those can be pretty similar in their accuracy. Then what do we have next? Which one? There's 3 different iterations. Yeah, probably the 4-point BIA, then skin fold calipers, then the standing BIA, followed by the handheld. That's okay. So like anything else, in a skilled practitioner's hands, skin fold calipers are definitely not bad. It's obviously when people don't really know what they're doing, that's when we're going to have the bigger issues. And so like anything else, the handheld BIAs are not the best for accuracy, and same thing with the standing. So, why do we care about percent body fat? Yup. Everything except for because reasons. Absolutely, Abby. Great job there. Now, 25, I think, is a good one. So with that sport, where can you see that optimal body fat for competition is going to quite possibly be at the expense of the athlete's health? Why? Okay, so notice there's different pressures, but absolutely. Cheerleaders, specifically flyers, have very, very high pressures to be very small. Exactly. There's weight classes in wrestling. So the goal is to be as lean effectively as possible and as light as possible by the extension of that fact in your given weight class. So like anything else, you can tend to have some perverse incentives there. And then obviously for football, when it comes to linemen, the goal is to just be a very large human, which makes them harder to push around. And that in turn can typically leads to having very high percentage of body fat, which is going to obviously have its own risks associated with it. And then with 26, it's A, B, and C. Weight standards are dumb because if you've got a lot of muscle, it'll work against you. We're not trying to do psychological harm to the people we work with. And then quite frequently, it's not going to really influence our performance in a meaningful way when we're inside of that healthy range. That range is going to have it's going to have flexibility on either side. It's not like they need to be exactly 15% body fat, 0.0. It's like, well, okay, that athlete male is probably going to perform pretty well, somewhere between 12 to say 18% in their given position in the sport of baseball. If they go lower than that, okay, now we're a little too lean. Maybe now we're increasing the risk of injury. We got a little padding in the body. Other side, well, now we're going a little too high. Now we got some extra body weight that we're carrying around that's probably just going to be slowing us down and not allowing us to be as powerful as we'd like to be relative to our own body weight. So like anything else, we want to get an idea of, okay, what's going to be kind of that optimal spot in that range that we want to have our athlete be at. So it's about 2:10. Are there any other questions that you guys have now that you guys would like me to go ahead and touch on? So remember, there will be no lab this week, so enjoy your Friday. We will be reviewing again on Wednesday. Come with questions. We can obviously finish up this one, which I will make no promises that you're going to see anything like this on your actual final exam. Otherwise, guys, take care of yourselves. Stay safe out there, and I will see you guys again on Wednesday. And then remember, you just got your final exam. When you hit start, you've got 7 hours from there to answer all of the questions. I think there's like 14 or 15 questions. They're all effectively kind of short answer / essay questions. So most folks finish the exam in less than 2 hours, but I want to give you guys plenty of time because it's obviously open book, open note, and I want you guys to do your best and make sure you're actively answering the questions that are on the final. So if there's no other questions, comments, concerns, you guys have a nice day out there. You guys stay safe, and I will see you guys on Wednesday. So bye-bye.